So now we're going to do a muscle called Serratus Anterior, which is a super important muscle for shoulder stabilization. We see it in our books and think of it as this tiny little muscle on the sides of the body, but it's actually a really giant set of muscles that stabilize the shoulder. And so on a lot of clients, this will get really stuck. It will both force their shoulders forward and keep them there, but also impact and restrict their breathing. And so getting this to move a little bit better again will help with a bunch of different shoulder issues, but also improve breathing, which just helps the body all together. So, in order to find it, we are basically talking about a set of muscles that run sort of like my fingers. They're gonna start at the medial edge of the scapula all the way underneath and on the inside edge. So between the scapula and the ribs, you're not gonna see it on camera. There's no way to see the inner attachment. But just imagine it comes and attaches along the rib cage here, like fingers, individual heads of muscle that come up through behind the shoulder blade and attach on the front anterior side of the shoulder blade, but all the way at the medial border. And if you think about that contracting, it's going to take that medial border and contract and pull it in that direction. So if you take your arm and just slide your shoulder that way, that's firing serratus. And so here it's loose under my fingers, and then that is going to make it fire and make these muscles pop out under my fingers. And so that's one way that you can know that you're in the right place, is if they're moving their shoulder girdle, not just the arm, but the actual shoulder blade, forward and protracting it in front of their body. You're going to feel serratus anterior tighten up right in this space, like little heads of muscle roughly where my fingers are. So let that relax for a second. Now, in order to work on it, and it's going to attach in slightly different places on different people. If you're a gymnast and using shoulder stabilization to that extreme level all the time, your serratus is going to be this gigantic superhero type muscle. And if you're not doing a lot of that kind of stuff, handstands, push-ups, things like that, it might be a lot on the weaker side and not as big or as solid, and it might not attach to quite as many ribs on some clients as others. It can have different configurations, but in general you're going to see it attach all the way down to rib 9 on most people and all the way up to rib 4, sometimes rib 3. Now fascially, we can sort of just grab this tissue here and slide everything back towards the shoulder blade, and that is going to help to fascially release serratus. And that is one way to do this in side lying. There's plenty of ways to do this in supine as well. But again, if you're dealing with clients that have a lot of shoulder injuries, you're going to want to make sure to get into this space here. So once more, I'm going to contact the belly of the muscle. I want you, Brianna, to try to slide your arm forward, and you're going to feel the muscle under my fingers, and then let go. Good. And again. And let go. And again. And let go. And hopefully what's happening as I'm doing that is the shoulder blade is sliding further and further towards the spine.